Hi, I'm Paul Sadler, CEO of Presbyterian Aged Care. We are now 6 months into the coronavirus or COVID-19 pandemic. Unfortunately, we've seen how dangerous this disease can be for older people with the unfolding tragedy in Victoria. We want to update all our residents, home care consumers and their families and friends on how PAC is responding. We have a detailed COVID-19 response plan in place which is guiding all our actions. We've thought and planned for all possible outcomes. Our crisis management team is meeting regularly, at the moment 3 times a week, and both our board and clinical care and safety committee have provided input into our response plan. The plan is updated regularly as new information about COVID-19 comes to light from government and other sources. Our staff are on the front line of caring for older people during this pandemic. PAC has taken active steps to ensure our staff protect themselves and the consumers they work with. Well before the Fair Work Commission supported the introduction of paid pandemic leave, PAC put into place special paid leave provisions for staff who are being tested for COVID-19 or feeling unwell in any way. We also applied for a federal government retention bonus and have already paid a first instalment to our frontline staff. We know that infection control training is critical for our staff. Rest assured, we were quick to provide a refresher course on infection control when the pandemic first started. We're following this up with specific training on donning and doffing personal protective equipment. We have now mandated the use of face masks for all residential care and home care staff providing personal care in the majority of our services. This will remain in place where there are levels of community transmission. In our retirement villages, we've continued to limit group activities and the use of common rooms. Where a local hotspot is declared by public health authorities, group activities have been suspended. We are due to hold the annual village management meetings in October. Alternative arrangements such as letters, emails or video conference meetings will be adopted if necessary. In our home care services, we tentatively reopened some group activities at our day centres a couple of months ago, but have had to shut some of them back down due to local hotspots. We continue to provide our vital home care services, which help people over 70 stay in their own homes and self-isolate by assisting with shopping and other tasks. We also assist home care consumers to connect with their families via technology like FaceTime or Zoom, as well as to access telehealth services. On the 13th of May, PAC adopted the industry code on visitation to residential care services during COVID-19. This code was negotiated between national provider and consumer peak bodies. It has guided our approach to visits by family and friends, but public health authorities have recently required us to adopt tighter visitor restrictions at some services. The visitation policy is reviewed regularly and we will reinstate in-person visitation when public health authorities allow us to. As you know, we've put on extra staff and purchased additional iPads at all of our services to help residents interact with their loved ones remotely. The iPads can also be used to access telehealth services. We've introduced an online booking system called Zipline for some of our residential care services, and we anticipate rolling it out to all services in the coming months. This allows checking of flu vaccination status and locations visitors have been to. It keeps an electronic record should this be needed. Zipline visits are booked on the PAC website. As I record this message, no PAC service has been directly impacted by a case of COVID-19. If there is an outbreak affecting one of our services, we want you to know what to expect. Federal and state authorities have made it clear that a single case of COVID-19 will require the implementation of emergency procedures. If a case occurs linked to one of our facilities, we will implement lockdown procedures as per our infection control manual and work in conjunction with the public health unit. We will adopt a strategy of isolate and cohort, which means some residents may need to be moved to a different room to protect themselves or others. PAC will also be advocating for the transfer to hospital of any confirmed cases. We support Aged and Community Services Australia, who are advocating that residential aged care is not a hospital and should not be used to treat sick residents during a pandemic. Experience has shown that the impact on aged care services can be dramatic if an outbreak occurs, with some services losing all of their staff to isolation for a period of time. We would be working with federal and state authorities to support access to personal protective equipment and staff support from day one of an outbreak. Communication with consumers and families will be very important. Please make sure our services have your current contact information, including emails and up-to-date mobile phone details. If you are a nominated representative, please remember that PAC will be relying on you to keep other family members and friends informed. Useful information, including videos on what to expect in the case of an outbreak, are available from the Older Persons Advocacy Network and the Aged Care Quality and Safety Commission. We will continue to act on advice from the public health authorities throughout this pandemic, so further changes to our services may occur, and if they do, we will notify you promptly. We can be reassured that God promises, "I will never leave you or forsake you." If we can help you in any way or you have any questions for us, please contact us at 1800 722 679, email us at info@pcnsw.org.au, or reach out to your service manager. Our top priority remains the health and welfare of our residents and consumers. We will continue to do everything possible to protect you, and we want you to know that we have detailed COVID-19 response plans in place should any outbreak occur. God bless you all and keep well.